You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are aging. With us, we have an expert on the topic. He is the desert's favorite board-certified plastic surgeon, Dr. Mo Zakhireh. Dr. Zakhireh, welcome to the program.
Thanks, Randy. Thanks for having me.
You're at least my favorite.
Thank you. Thank you.
For sure. Now, people need to know, it's a real interview. I'm not endorsing you. I have sent you loved ones to go to you. I have plastic surgery friends all over the place.
Thank you.
Hopefully they won't see this show, but I send people to you. So for people, kind of bring me up to speed. I mean, I met you, seems like about 10 years ago. What's changed? I mean, what's new? How much better are you now at making people look years younger?
The best part of what's going on right now is there's always been a lot of hubbub and a lot of, pomp and circumstance about these lower minimal invasive technologies. But the problem is the promise was made, but the technology didn't live up to it. Now the technology is actually starting to live up to the hype. So for example, we've just acquired a new Ultherapy technology that tightens and lifts the skin of the neck and the jawline, the jowls, and this area also gives a very nice brow lift.
So what is it? It's like a laser, or what is it?
Well, it's an ultrasound, focused beam ultrasound technology that actually penetrates the skin about 4 millimeters deep, 3 millimeters deep, 2 millimeters deep, and then we couple that with the erbium cyton laser that we have that also helps to tighten the skin. So now not only are you getting a lifting of the skin, but you're also getting a lifting and tightening of the muscles. So you're not only fixing the infrastructure, but you're also able to fix the sun damage on the skin, tighten the pores. You're just able to physiologically rejuvenate that skin and also the underlying tissues. That is really the first time that we've been able to achieve these kinds of results and make somebody look 5 to 10 years younger without actually doing surgery on them.
Okay, good.
Okay, and there's hardly, for the Ultherapy, there's absolutely no downtime involved. And with the lasering, because now we're using PRP and also we're using a silastic sterile silicone sheeting, which
and PRP is what?
PRP is platelet-rich plasma. You actually take the blood and you spin it down and you separate the platelets and things like that, and then you add it back in and you spray it back on, and what it does is it physiologically sends messages to the body, says, hey, this area is broken down, fix it. So things heal a lot faster, and also with the artificial skin, the body gets fooled into thinking it hasn't had anything done. So within 3 days, when you peel that skin back, the laser results are healed. It's
Wow.
fantastic. It's amazing. So we're able to now do much more but have a lower downtime for the patients. So, the name of the game today is people want to get back to their lives, ASAP. They want to get back to work, they want to get back to playing golf, things like that. So those are all the newer things that we have available to us. However, realistically, I live in a community where the average age is 64. Mm-hmm. So a lot of these people may come in, they're like, you know what, I want a little bit more than just a tiny bit of lift. I want more than, cleaning up my skin. I have these jowls, or, I have these really, really sagging neck. These people come in and they open themselves up, to me. And, within 10 minutes of meeting them, they actually, lay it on the line. And, a lot of times they start to cry. And so, these two ladies, the mother and the daughter, the mom just had the big jowls and they had the hanging neck. Mm-hmm. The daughter, interestingly enough, because of the stress, all of the fat from around her eyes had totally disappeared. Her face just looked sunken in and everything had fallen. So, it's cute.
Like when you look at these people, by the way, and sorry to interrupt.
No problem.
Do you see the end result? Do you go, this is going to be good?
Yes, it started to happen. I've been in my career for 13 years now. It started to happen about 10 years ago, where I can actually look at somebody and I can see the end results, and it's fantastic. I mean, I get goosebumps when I'm talking to them.
Wow.
And I think, it's really neat because I don't have to say anything. They understand the energy being, kind of put into, and the emotions. So, make a long story short, this mom and their daughter, I did the mom's facelift on a Monday, and I did the daughter's facelift on a Tuesday. And they both have healed up, and they both look amazing, and the energy and they're both very vibrant, and the mom is actually, in her late 70s, but she just has so much energy. She actually has more energy than people I know in their 20s and 30s. She looks fantastic.
The results you're getting today, because I guess people don't, I mean, it's true, there comes a point where you need surgery, and you don't have to look done.
Absolutely.
So I'll let you go, because you brought some photos. I said, bring some photos.
Sure, yeah, and I think pictures always speak the loudest. I just want you to sort of take a look at this lady's before picture. So when she came in, she had the looseness in her neck, and she had the complaint of her, eyes being hollow. Right?
Well, she looks pretty good to start with, by the way.
She's a very pretty lady, and so she just wanted to improve upon that. So conservatively, I told her that we can do some alt therapy on your neck, which actually focuses a beam deep into the neck, and it melts away the fat, and it also tightens the tissues. However, after examining her neck, she also had looseness of the muscles in the neck, the platysma muscles. Okay. And so I suggested for her that it may be a good idea to do a conservative neck lift. And then also, she had hollowing in her eyes, which, you can take care of that with fillers, but if the patient has their own fat, I like to do fat grafting to the eyes, because that's a biological filler. It's like material to that area. It's native material, and so that area is very dynamic. When you smile and things like that, if you do fat grafting, then things move the same way. Whereas if you do fillers, the fillers have a different consistency, so when you smile, they move at a different speed, and the fillers may actually cause lines in that area. So, after I explained everything to her like that, then she was more comfortable with actually doing a facelift, and, in her situation, this was the right thing to do, because after the fact, when you look at her neck, it's nice and tight the way down to the décolleté area, and her eyes they don't look done. She has her own eyes, but 15 to 20 years younger. Now, keep in mind, in the after shot, she may look a little bit tight or pulled, and that's because, she's number one smiling, and also she had just had a facial, so her skin looks a little bit shiny. Okay. Now, one more thing I'd like to point out, Randy, is I've been doing fat grafting to the dorsum of people's noses, and their noses look the same, but, this, in the before shot, she just had a little bit of a drop-off in her nose right there. And I was able to fill that in and make a nice, smooth dorsal line for her. And she looks like herself.
Her nose looks better.
Looks more elegant. Now, let's go on to the lateral pictures on this same patient. And you can clearly see that this patient's under eyes don't look done. They don't look puffy. It's just a nice and smooth taper. And also, as a result of the foundational work of the facelift, her jowls have been emptied out, and all of this tissue actually came back up to her cheekbones. And so her malar region looks filled back up. And that's not, I don't do malar implants or anything like that. That's her own tissues. And going back and reviewing her pictures, she looks like herself, but,
that's fat
15 years.
Adding her own fat under her eye.
Absolutely.
Over a filler. You do about, I think you said, like 5 of these a week. Mm-hmm.
Yeah, it's really a beautiful way to do it. And I've said to you before that fat.
Don't you think I need it?
No, I don't think so.
You don't think I need it?
You're very, you're a good-looking guy. You're handsome, Randy.
You're afraid that if you tell me I need, I'm going to go there and ask for it for free.
No.
I totally have you figured out, Dr. Zakhireh. That's why you're laughing, because that's what you think. Oh, brother. Okay, anyway.
So, by the way, Randy, I would like to point out that you gave me this tie. You gifted it to me about 7 years ago, and I still wear it. It's my lucky tie. I still wear it and come out here and film. And
I knew that tie
it means a lot to me. So
I know that
I appreciate it. Now, let's move on to sort of something less invasive. We're talking about a fat grafting and laser on this lady. And I want you to pay attention to this patient's hollow eyes, and also want you to pay attention to the texture of her skin, and I want you to pay attention to the lines that she has around her lips, which is called the perioral irides.
Okay.
A lot of times people come in nowadays, and again, they feel like they don't represent the way they look on the outside in the workforce. And they keep coming in and they say, I want to look more presentable, because I'm a realtor, or because they're in outside sales, or they're in customer service and things like that. We're hearing that more and more now. And so, for these types of people, it is so, really, if you diagnose things the right way, it is very easy to give them the results that they want without overdoing it or without putting them through a face and neck lift.
Or different.
Yeah, exactly. And so, with a little bit of fat grafting to the lower eyelids.
So that's what you did for her.
Absolutely. A little bit of fat grafting to the lower eyelids, a little bit of fat grafting to the malar region, to the nasolabial folds and jowls, and a good round of lasering. This patient looks fantastic. Look at the under eyes before and after. Significant difference.
Yeah, they're gone.
She's more rejuvenated now, whereas before she looked hollowed out and it made her look old. Look at the lips. The area around the lips is the lines are gone.
What did you do to her mouth to get rid of that? Is that just laser?
I'm glad you asked. It's a combination. We do lasering, around the mouth to make the lines go away, but also I do a little bit of fat grafting.
Her own fat?
To the lips, absolutely. And as I've said before, the fat, I like to get it from the infraumbilical or right below the belly button region, because each milliliter of fat has 20 million stem cells. So I tell the patients, I'm doing fat on your lips not to give you the duck lips or make you look done. I don't think, had I not said that, I don't think that you would have noted that her lips have been done. And that's because I put just enough fat in there to recruit blood supply. Recruiting the blood supply actually increases the collagen content of the lips, and it makes them look soft and supple, Then you can come back and, this cinch sacking or the lines like this are also the result of a very strong muscle, the orbicularis oris. You can come back and just release the edge of that muscle with 1 to 2 drops of Botox here and here.
Wow.
And then that relaxes that muscle, and it also brings the edge of the lip out, and it makes it look pouty. Now, I didn't do the Botox on this patient, but I did the laser and the fat grafting. So, there are so many different things that can be done for the lips, but people don't know that, or they get scared because they see somebody's lips and they look done and they look ducky, and so people shy away from that. But, it's a shame, because I think that if done well, it can look wonderful. Now, Randy, I want to point something else out to you. I want you to notice this patient's hair, how it changed from before to after, The hairstyles begin to change.
Interesting.
The eye makeup begins to change. The clothing begins to change. And again, these people blossom into, I was taking somebody's facelift stitches out, and she's a very nice lady, but she's very stoic. Some of the patients are very quiet. So as I was taking out her stitches, she started to tell me how she feels that her life has been moved back by 20 to 30 years, and that how she has been able to erase traumas, and she feels that she can go back now, and she has the wisdom, and she can go back now and erase some of her mistakes and redo things over again that she hasn't, felt like she was able to do before. When she was telling me this, it really struck me. I got goosebumps, and I started to tear up. And then when I looked at her, she was actually crying. And my God, what a gift that was to me. Those words really touched me, and it's really neat. Now, with that said, do you want to take a look at some other patients?
Let's take a look at more.
Now I'm getting excited, and I'm really,
we have some time. It's good. I like that you know what, you're one of the guys. It's like you're showing me baby pictures. You're proud of this stuff.
Yeah.
Which, you could tell.
Yeah. Actually, Randy, one of the most common questions I get is, because we do so many surgeries and so many different, procedures, everybody always asks me, what's your favorite procedure? And I'm like,
what is it?
I can't say, because to me, it's kind of like you got 3-4 kids and somebody asks you, well, which one's your favorite kid? You can't say. They all have
Okay.
different personalities, and they're all your babies. So I love everything that I do, and I can't see myself parting with one of my surgeries, breast, tummy tuck, lipo, faces. I just love doing all of that, and it's really where my passion lies. Now, with that said, we have another very similar patient to the previous one that I presented to you. Take note of this lady's, first of all, very heavy upper eyelids, very hollow lower eyelids, and the texture of the skin is somewhat leathery, and then you got the lines around the mouth. And this is another one of those stories where this lady just felt like her heart doesn't match her face.
Okay.
And so she just wanted to look fresher in the workforce. But she said she didn't really want to commit to a face and neck lift, not yet, because this is the first time that she's ever considered doing something like this.
All right.
And she just wanted to start out slow. Okay. So you have to really pay attention to these patients' needs. But I want you to pay attention to the upper eyelid, the before and the after. If I hadn't pointed it out to you, you probably wouldn't recognize that she's had her upper eyelids done because she looks very natural. But now that you can compare, her upper eyelids were so heavy that they were actually weighing on their lash line. And that actually causes problems with night vision, night driving, and being tired in the evenings because your eyelids are so heavy, they're weighing down on your lash line, and you have to bring them back up using your frontalis muscle. So being engaged with the frontalis muscle all day long really takes a lot of energy, and it makes one very tired. Next, let's move to the lower eyelid.
Yeah, under the eyes. I mean, that's really big difference.
Yeah, and actually her lower eyelids were very complicated because she was puffy, but then underneath the puffiness, her tear troughs were hollow. So what I had to do is I had to take the puffiness down, but I had to build up the hollowness by adding fat to them. So I brought them back
Adding
into
fat,
line.
her own fat.
Correct.
Underneath her eyes.
Correct. So that was actually
And that'll last for how long? I mean, that'll last a long time?
Oh, that lasts a long time. So that's a very interesting question you asked, because your fat is your own fat and it becomes a permanent filler. The body grows blood supply into it and it becomes permanent, and it takes. Now, that's a complex question to answer because it relates to your own genetics, your own metabolism, how much you drink, how much you sleep, how much do you smoke, how much do you diet, your nutrition, all of those things, and how much stress you have. So, for example, I did fat grafting on a male patient.
Yeah.
He and I have subsequently become friends, and he's a great guy. And about 2.5 years out, he came in, and he all of a sudden looked hollow. And I said, what happened, He goes, I don't know, but, my fat's disappeared. Can you put some back in? And I said, sure, absolutely, I can put some back in. But, what's going on in your life? Do you have any stress? He said, yeah, my wife was just diagnosed with breast cancer. Okay. And so, that stress all of a sudden made all that fat disappear. Or I have another friend who, when I was at the University of Utah, I did fat grafting for her, and she's a very, very strong triathlete. She was training for a triathlon, and she literally ate all the fat on her body, and she lost the fat. But the cool thing is that if you come back a second time and do fat grafting, that fat stays. And on her particular case, she's 10 years out now, and her face still looks fantastic. That fat hasn't gone away.
Yeah, because you are like the eye guy for natural. And what's the downtime? I mean, if everything goes right for just under the eyes, adding fat.
I would say, 7 to 10 days. A little bit of swelling, maybe a little bit of bruising. But,
with makeup, you can go back to
absolutely, absolutely. With makeup, you can go back
Are more and more
within
guys
7
coming
days.
in, or still it's about 70% women for surgical procedures?
It's funny. We have more and more guys coming in, but it's really interesting. We have two different subsets coming in. We have, the guys coming in on their own, but then we have the guys coming in and they come in with their wives. And after we do the wife's surgery, they say, you know what, I want to look good. My wife looks good now, and I look old, so I want to get done. So it's really neat because, to me, that's ultimately a compliment that the husbands, at first they come in, they're kind of grouchy, and they look at me like, who are you, And
yeah.
But after they just get to observe and they see what can be done, then they want to come in and they want to do, surgery. Now, it's really interesting because we have a whole new subset of guys coming in for liposuction, and they are in the military. And for whatever reason, they can't, even if they can do their 20 push-ups and 20 pull-ups and run their mile in under, 6 minutes or whatever, they tape them now, which is they put tape around their chest and around their waistline, and the measurement gets equated into the formula. And even if they pass the other criteria, they fail as a result of the taping. Again, it not only holds them back for promotion, but it's just they feel very frumpy.
Okay.
And they can't tuck their shirts in. So here's a guy, he's a young Marine. He's absolutely in phenomenal shape. He's full, his body's just muscular, but he just cannot get rid of the fat, the baby fat and the pooch. So, they come in, we do liposuction of their torso, and, if you look at the after picture, so, notice in the before picture, he's got the full love handles.
Very
and
nice.
The whole side of the torso looks full. And this picture, he has a little bit of bruising, and I'm actually glad that I brought this picture because this is 1 week out. So he already at 1 week out looks really good, but in this after picture, honestly, he's still very swollen. So these guys, especially the ones that are young and healthy, you get rid of that fat, and I mean, you're gonna have a solid six-pack underneath, you're gonna have solid pecs, their lats come out, everything looks good. Now, it's really interesting because, the more I have been in practice, the more I learn about the physiology of fat. This particular guy, his fat is producing a lot of estrogen. Estrogen being the hormone of pregnancy, is sending a response to the brain saying, hey, slow down the metabolism, we're eating for two. So no matter what these people do, no matter how much they run, no matter how well their nutrition is, at some point they plateau and they can't do any more. So it's very important to know the physiology of the estrogen. Now, the last thing I want to add is for all of our patients now, we're doing nutritional counseling, and I find that is very important.
And we have about a minute left, but this is good. This is good.
It's very important because, I do a lot of self-reading and self-education, and, our diet today in our country has so much corn syrup, cornstarch in it. Everything is corn-fed, the fish, the chicken, everything. Our eggs, everything. So the level of omega-6 fatty acids in our diet is very high. And that's an inflammatory fatty acid. That's why we're all chubby, unhealthy. That's why we have high blood pressure. Our triglycerides are high. So if we can notch down the level of omega-6s and bring up our omega-3 fatty acids,
fish oils, things like that,
which are fish oils, and just, if you're going to eat beef or whatever, grass-fed beef, organic chicken, wild-caught salmon, buffalo burgers, things like that are very good to eat. And supplement with a lot of vegetables. The vegetables are antioxidants. They help to flush all the toxins out of their body. And so
for you as a plastic surgeon, people are healing better.
Healing much better.
When you tell them and advise them how to eat.
Healing much better.
Interesting.
We're helping people get rid of their type 2 diabetes, and we're helping them get rid of their high blood pressure.
Always a pleasure to have you on the show.
Randy, just one more, please.
Okay, one more.
Can we just take time? This is my favorite patient that I wanted to present to you.
Okay.
I've talked about her on the show before, but it's still a result that I need to talk about.
It's a facelift patient.
Absolutely. It's a face and neck lift patient, a lady who just looked tired.
Okay.
And when she looked in the mirror, because she looked tired, she had started to act tired and had started to act older, had lost her sense of humor, and was just a little bit blue maybe, was seeing the cup half empty, okay? So I took her in and I did a very conservative face and neck lift on her. Notice the full jowls now after the fact they're gone. And I did a upper blepharoplasty on her, and I did a mid facelift on her, and did some fat to her lower eyelids, to her upper and lower lips, and the dorsum of her nose. And to top it off, we did the erbium cyton laser on her. Now, if you were to look at this patient, if you were to see her on the street, what would you say?
Well, I wouldn't say she's had a facelift.
Yeah, I mean, she just looks pretty.
And she looks prettier. I mean, you've literally increased her attractiveness. I mean, she's, without being superficial, much prettier in the after. Now, I know there's a little secret about this particular woman.
Yes.
This is your mother.
So she happens to be my mom, and so I've had, now their facelift is 7 years old, still stands up very nice, looks great.
I mean, is this your best facelift ever? I mean, this is very nice.
Yes, thank you. But I want more of these. I want to be able to catch these patients earlier and to be able to change their lives. Now, because, she's my mom, I see her, she cracks jokes, she's always laughing and smiling, her sense of humor has changed, she's just much more social and outgoing. So I feel like I can do more if I can.
She looks 15 years younger.
Thank you.
She looks like the daughter of the woman in the before.
Yeah, and I'll tell you this, I'm a little bit uncomfortable with this, but when I go to restaurants with my mom, sometimes the waiter
They think it's like a date?
Yeah, and it's just like, I'm like, don't go there, please.
You have to say, no, this is my mother that I gave a facelift to. Natural looking facelift.
It is just, so.
You look better than ever, by the way. I mean, you
Thank
walked
you.
in our studio, and you even changed in front of me. You took off your shirt. I mean, you're in great shape.
Thank you, it's the tie.
So you're walking your talk.
It's the tie, thanks.
It's the tie. So, but final message, because we talked about facelifting, and I guess, look, if you don't like, because you say it's not for everyone, but if you don't like the way you're aging, if you don't like the way you look, what do you say to these women?
The good thing is now in our society, in our culture, with the technology that we have, there is just so much more available. And if you don't want to have surgery, that's fine. You can have wonderful, no downtime, modalities, technologies that actually work now.
Okay.
Whereas before it didn't. So that to me is just fantastic.
Good for you. I want to thank you for coming in. We're
Thank
out
you.
of time.
Thanks
Always
for
a
having
pleasure,
me.
Dr. Zakhireh.
Thanks,
and
Randy.
and you said you were going to bring me some Botox. So you're going to Botox me immediately
bet.
after this show.
You bet.
You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.